Hey, I'm glad you made it. We wouldn't start without you. It's time for an apple fritter. Here's your host, Jimmy Apple.
Welcome to another episode of An Apple a Day's The Fritter. I'm your host, Jimmy Apple. How you feeling today, my friend? You feeling good? You feeling strong? You feeling better than you did yesterday? Excellent. You can't ask for better than that. We have got a good one for you today. Are you a nail biter? Do you do it without even thinking? Do you bite your nails down so low that your fingertips start to bleed, or your nail beds start to bleed, your fingers hurt? Well, you're not alone. More than 30% of Americans are nail biters, and they do it absent-mindedly. They just do it. It's a habit that they can't break. It's disgusting, if you ask me, because your fingers are everywhere. You're touching elevator buttons, you're reading newspapers, your fingers touch everything. And then you're sticking them in your mouth, and you don't even think about it, and you're biting your nails. You don't know what's under your nails. Well, we have Dave here today. He's going to tell us how to stop biting your nails. I want you to sit back, relax, and listen to what Dave has to say.
How to stop nail biting. A combination of treatments can help you conquer the compulsion. Do you find yourself absent-mindedly chewing on or biting your fingernails, and when you try to quit the habit, it just doesn't take? Rest assured that you're not alone. Although to many people, nail biting is an occasional thing, for 20% to 30% or more of Americans, nail biting is a behavior they can't stop on their own. In fact, healthcare providers classify chronic nail biting as a type of obsessive-compulsive disorder or a body-focused repetitive behavior, BFRB. There's even a name for chronic nail biting, onychophagia. Although providers don't fully understand the cause of chronic nail biting, there are ways to halt the habit. Preventive medicine physician and wellness expert Sandra Darling, D.O., shares tips on how to stop nail biting. How do people stop biting their nails? When you're a chronic nail biter, you often want to stop, and may have even made multiple attempts to quit, without success. But people with onychophagia can't stop the behavior on their own. In other words, it doesn't help to tell someone to stop, and reprimanding them only makes them feel worse because it reinforces their feelings of being flawed. But you can get closer to recovery with repeated effort and self-care. Dr. Darling usually recommends a combination treatment approach that includes behavioral therapy. Therapy can help release the shame and negative emotions that often accompany nail biting. It can also help increase awareness of your triggers and urges. In some cases, habit reversal training or hypnotherapy are effective. Self-care and relaxation. Self-care, like regular meals, more movement and ample sleep, helps you feel calmer, more confident and resilient, giving you the strength to recover. Nail biting satisfies a strong urge, so to quiet your mind and ease the tension created by the urge, we recommend meditation, journaling and yoga. Social support. Talking to a support buddy when you feel the urge to bite your nails can help you get through the stressful moment. The TLC Foundation for Body-Focused Repetitive Behaviors offers a directory of support groups and educational events. Treatment of any psychiatric disorders. People with chronic nail biting may need medications or behavioral therapy to address a related condition. We do know that people with the following conditions often have onychophagia as well: attention deficit hyperactivity disorder, ADHD, oppositional defiant disorder, separation anxiety disorder, Tourette syndrome. Other BFRBs: chronic skin picking, hair pulling, cheek biting and grinding teeth. Nail biting deterrent polish. Let's face it, nail polish doesn't taste good. But there is actually a variety of nail polishes made specifically to deter you from biting your nails. This polish tastes particularly bitter or foul on purpose, and people have found it to be an effective way to stop biting. Why do people bite their nails? Chronic nail biting often has a self-soothing quality. In fact, it provides a sense of calm, so people may use it as a coping mechanism. Sometimes, a hangnail or nail imperfection spurs you to groom a nail excessively, in order to improve the look of your nail. Unfortunately, this often makes the nail look worse. People also bite their nails when feeling stressed or bored, while watching TV or when focusing on a task like reading. When does nail biting become a problem? You should seek medical treatment if nail biting is causing physical damage to your nail, cuticle or surrounding skin, or if there are signs of an infection, including redness, pain or swelling. If nail biting is causing you psychological distress, such as shame, anxiety, depression or low self-esteem, a mental health provider can help. It's important to discuss your concerns with a professional if the behavior is affecting your social life too or affects your professional life or job performance. As always, I hope you found this informative and interesting. I'm gonna pass this back over to Jimmy. Have a wonderful day.
Now, who thought that biting your nails could be an addiction like smoking cigarettes or using tobacco products or drinking or drugs? Who would have thought that it's that addictive? I wouldn't. But anyway, I want to thank you, Dave, for that information. And I want to thank you, the listener, for being here today. And I want to remind you, An Apple a Day has chat boards that you can go and join. There's Living with a Disability, which is a group that we discuss problems or questions pertaining to Social Security, doctor's appointments, stuff like that, where people who have questions, they can ask them, and people who have answers can answer them, and that we just have discussions. We're making new friends, we're chatting with old friends. It's a nice, close group. Check it out. The address for this group will be in the show notes for this episode. As well, we have Apple a Day Chat, which is about this podcast. You can talk about anything that has to do with the podcast. You can talk about an episode. You can talk about anything. You can add your points. You can suggest topics for an episode. You want to be a guest on the episode, you can let us know. But you can go to an Apple a Day Chat. Again, the addresses will be in the show notes for this episode, so you want to check them out. And I want to remind you, we have some good guests coming up this month on an Apple a Day podcast. You're not going to want to miss. We had a great guest on last week that you want to check out. It was about ataxia and an interview with Christy Taylor. Christy is a model, but she also suffers from ataxia. She is a bright star. She's wonderful, she's warm, she's engaging. You really want to hear that interview. It's the only thing I can tell you. When it comes to talking about ataxia, this woman knows what she's talking about, but she's not all about a disease. She's empowering. So you got to check out Interview with Christy Taylor. It's titled Ataxia, Interview with Christy Taylor. It came out last week. You got to check that out. Well, again, my name is Jimmy Apple. You've been listening to An Apple a Day's the Fritter. And I'll talk to you again real soon. Have a great one, my friends.
Join Jimmy tomorrow for another Apple Fritter. In the meantime, stop over at our YouTube group page, Living with a Disability, join in the conversation and make some new friends. See you next time.